Hi, everyone. We're live. I'm Debbie Schwartz, founder of Road to College and Paying for College 101. We're here tonight. We have two great guests, and we're going to be talking about mental health and wellness for your student, and maybe we can squeeze in a little bit for parents as well. But I'm just going to give people a chance to get notified, settle in. It's always great if you can put a comment in the post something in the comments about where you're from, what number of kids you have, what grade your kids are in. It just helps us to kind of know who's watching and, maybe to gear some of the content depending on if we've got more people in high school, with students in high school or students in college. So would love to hear a hello from anybody. I definitely see that there's over 50 people watching. So, good. Anna, hi. She has a senior. Charisse from Columbus, Georgia. Good. Okay. So please feel free. Put a comment in to say hi, and I am going to. Oh, hi, Leonard. I know Leonard. I'm gonna pass this to Betsy Jewell, who I've been doing these Facebook Lives with. Betsy also has a great podcast called High School Hamster Wheel. So I'm gonna let her introduce herself, and she's going to introduce both our lovely guests.
Thanks, Debbie. Hi, everybody. I'm glad to be back here again. Yes, I'm Betsy Jewell, and I am the host of the High School Hamster Wheel podcast, where we talk about all the things to help guide our teens through high school and beyond. I have 2 teenagers myself, so I'm living it as I talk about it. We're delighted tonight to welcome our guests. First up, Dr. Marcia Morris. Dr. Morris is an associate professor of psychiatry and the associate program director for Student Healthcare Center Psychiatry at the University of Florida. She's a distinguished fellow of the American Psychiatric Association and a member of its College Mental Health Caucus. She is the co-chair of the College Mental Health Task Force of the National Network of Depression Centers. Dr. Morris has spoken nationally and published articles about college mental health, suicide, and obsessive compulsive disorder. Through media and public speaking, Dr. Morris is committed to promoting wellness for university students. She writes a blog for Psychology Today on college wellness, and her book, would you like to hold up your book, Dr. Morris?
Yeah,
her book, The Campus Cure, A Parent's Guide to Mental Health and Wellness for College Students, was published in 2018. And I have that book and have personally read it and highly recommend it. Thanks for being here, Dr. Morris.
Well, thank you for having me. We're talking about some very important things tonight. Hopefully it will be helpful. Yeah.
Our other guest, welcome, Joanna, is Joanna Lilley. Joanna is a therapeutic consultant, a gap year consultant, and a college success coach. She specializes in helping young adults and their families during the most important time of their adulthood, proactively supporting young adults with mental health history who are launching into the collegiate world, or reactively providing support where the young adult launches and unravels. Thank you so much for being here, Joanna.
Thanks for having me.
All right, so we have some questions we're going to start with, but please feel free to put them in the comments. Anything else, Debbie, before we get started?
No, everybody, ask questions. I'm gonna, try and pick them out as we go through the conversation, or we'll circle back at the end. But this is, both a combination of we've created questions, but we also want to make sure that we're answering, your questions as well. So don't be afraid to ask. And I know you aren't, so.
Okay, I think we'll start kind of high level and talk about uncertainty, right? I mean, we're all living with uncertainty. Our kids have lots of uncertainty. They've lost things in high school. They've lost things in college. There have been changes that they didn't see coming. And there's going to be a lot of changes in the fall, but we don't know what they are yet. So if either one of you can start, can we talk about how do we help our kids through all this uncertainty? What are some strategies or some things we can do to help them become more comfortable with the unknown?
Do you want me to go first?
Sure.
I mean, just all I can First of all, I think the only thing that's certain, if anything, is that there's definitely an increase in kind of the need for mental health services right now. So that exists. And then just in terms of the uncertainty, I think we're living in a world of, where we're kind of, especially with the bridge from high school to college, we know exactly what to expect, right? We have these experiences like prom, graduation, college enrollment. And so we have a very linear experience from high school to college for those that are college bound. And now all of that's been completely uprooted, which is, to me, when I worked in higher ed, it was the experience that a lot of my first semester college students would be kind of dealing with. This, all of a sudden, life is not linear. And so kind of having that, their first failure, their first change in the plans, it's certainly hard to deal with. I mean, we're talking about a public health epidemic, and so that's that the uncertainty exists, certainly.
Right, and there's certain uncertainty on so many levels for our young adults and college students, especially. We were just talking before the show started about what is going to happen in the fall for college students, especially for freshmen. Are they even going to be on campuses? And so it's interesting because, Betsy, you were talking about uncertainty and losses of the normal course of things. And Joanna, you talked about graduation. And I see college students very sad they're not going to have their graduation ceremony. But so along with the uncertainty is a tremendous amount of grief and sadness. And I was looking at the stages of grief, and they don't have to go in order, but it's denial, anger, bargaining, depression, and acceptance. And I do think a lot of people are still almost in shock by this, but they're feeling some anger, some depression. And so teaching our kids how to deal with grief is really important. And I was thinking about the grief aspect, how we want them to acknowledge the grief and not hide it or bury it, but we also have to teach them some acceptance that this is what's happening now, and also taking some actions to, deal with it. In other words, we don't want them to just sit in the house and feel sad. We want them to have some structure and find some activities they can do right now that are meaningful. But it is a time of both uncertainty and grief that not just our kids are feeling, but we're all feeling right now.
Totally.
Yeah, and all our kids are home, both high school and college, and their schedule has been turned upside down. So, they don't have that routine that they're used to, even if it was sleeping till noon on in their dorm, whatever it might be.
Yeah.
How can we help them readjust to this lack of the norm or the schedule that they've been on for so long?
Yeah, great question.
Well, Betsy, I think I mentioned to you before I use the shh, like to quiet your fears with a big shh. But like what parents can teach kids about, number one, the S of shh is structure. And number two, the H is health. Making sure they're following, the social distancing. I know we can't control a 20-year-old, but we can at least, say, hey, here's an article about what's going on. Be careful. If you're, walking outside with a friend, stay 6 feet apart, 6 feet or more. And then the other part of that is having some happiness too, and making sure they're not kind of crawling into bed and staying in bed, because that's easy to do right now. So making sure they're connecting with friends through Zoom and FaceTime and other media, and also doing things they enjoy. And again, I'm not expecting anyone to be happy right now, but we need to have moments of happiness in the day, because it's easy to just watch the news and feel sad all the time. And the last H I wanted to mention is hope, that we need to give them hope that this is going to end at some point. We're going to have a vaccine. We'll have the immunity, but we're going to have a rough time for the next probably year to year and a half. So, but we're gonna, I truly believe it with science, we can, work this through and find ways to be safe and happy. So, we just have to encourage our kids to just keep moving forward. And like, I have a lot of patients who are finishing online classes, and I'm, trying to encourage them, but thank God they're allowed to drop it without it showing up on their records too. So we want them to try to finish, but we also have to have empathy that it could be hard for some students. And a lot of schools are doing pass fail as well. But so we want them to but keep moving forward despite, how the news is bad lately. So have hope. Hope is critical.
So Betsy, do you mind me asking this question that Michelle has here? And I'm guessing, Dr. Marcia, maybe you can answer it. And I'll put it up here. So Michelle is saying she has a child with a history of anxiety and depression. And I've been told once my child starts college, I'll lose access to her, which is a kind of interesting point, and so she's wondering what her options are.
Oh, I'm so glad you asked this, Michelle, because I strongly encourage all my patients to sign what's called a release of information form, so that if a crisis arises, I can talk to parents. We don't want parents necessarily to read our treatment records, but when kids come to college, they're in a transitional phase, and sometimes they do go through hard times, and it's good to bring the parents into the conversation. So what I would say to you, Michelle, is you won't lose access to everything if you can encourage your child to sign that release of information form. More and more college psychiatrists are doing this, especially if a child has severe problems. They want to have some contact with the parents, but you can even ask your child and say, for your first session, can I call in and just let your psychiatrist know who I am? And, that I'm available. And, you can even, a parent can share perspective about how they feel things are going. So I do a lot of work with parents. And interestingly enough, I'm doing telepsychiatry now because a lot of my patients went home. And sometimes if a student is having a hard time, I'll say, do you mind if we bring your parent into the room, and they're home with their parents? So that way I talk with the parents, and I say, well, how do you think things are going? I get feedback from the parents about what they observe. So I think for this age group, if kids are, parents can be an integral part of treatment. And again, not all the time. Most of the time I don't speak with parents, but sometimes parents want to know who I am, and that's fine by me. And I encourage students to sign that release form.
And where would they get the release form? Would they have to?
It's in the clinic. Yeah. It's interesting because there are different kinds of forms. There might be a different form on campus versus an off-campus clinic, but it's the same idea that it allows the provider, the psychiatrist, to speak with the parent if needed. I'm not gonna reveal every detail to the parent either, because there are some things kids, might not want to reveal about relationships, etc. But I focus on the treatment, medication, side effects, especially if I'm changing medication. Sometimes students can have, worse symptoms. So I might say to the parent, please call your child more often now and check in with them. So I see parents as part of a collaborative team. Again, I'm not sure everyone sees it the way I do, but I think more and more psychiatrists on college campuses are. I think it's shifting in that direction.
I'd actually just throw out there too that, if your high school senior or current college student, soon-to-be college student, has any type of pre-existing mental health, whether that's medication, seeing a therapist, having been in treatment, I would also encourage every parent to also have the FERPA release signed so that you can actually access their grades. I'm not saying I'm not giving permission as a parent for you to check your kids' grades every day. What I'm saying is, as a parent, if you are concerned about the health of your child and you believe that they're not being honest with you about how they're actually doing on campus, having that release signed gives you access to truly seeing how they're doing academically, which could definitely be impacted based on their mental health.
And Joanna, one thing, I totally agree with you about that FERPA form.
Yeah.
And one thing I'd add is I do think it's a good idea to check the end of semester grades, because what happens is kids could be failing, their parents have no idea, and often it could be failing due to a mental health issue that they're not getting treatment for. And some schools are doing critical tracking where if a student starts failing earlier or mid-semester, they're going to reach out to the student and make contact. But at other schools, a kid could stop going to class a whole semester and no one would know. Again, changing. I know Cornell at one point started changing that and reaching out to parents if kids were having severe academic problems or, having mental health problems. And again, it's best to get the student to sign the release form and not reach out without the student's permission. That's the ideal way. But in rare instances, if it's a matter of life and death, the schools, there is something called the FERPA exception where a school can reach out to the parents in case of an emergency. So, but yeah, Joanna, I agree. I think it's really important to see the grades. I think that's extremely important.
So Kim is asking, how do you help students who are just anxious and even having trouble sleeping?
And I'm wondering if Kim, I don't know if Kim's referring to currently or just in general, because sleep problems are very common in high school and college students. And interestingly enough, sometimes over-the-counter melatonin can be helpful to regulate sleep. That's a simple thing. But ideally, the best way to regulate sleep is through behavioral methods like getting to bed at the same time every night, getting up at the same time in the morning. And I know that what's interesting about high school students is their bodies want to go to bed later and sleep later, but we still have to try to work with them. And there are some apps, sleep apps, actually 2 apps called Calm, C-A-L-M, and Headspace have some, kind of sleep meditations that help people fall asleep. But in general, though, we don't want them playing video games at night or looking at a screen at night. Common Headspace you can listen to, but if you're looking at a screen, you're getting what's called blue light, and that's going to keep you awake. So it's good to turn out the lights, read it, try and even read a hardcover book or something.
That puts you to sleep sometimes.
Interestingly enough, I mean, there's some proven methods like drinking a warm beverage before going to bed helps because it warms your body, then you cool down. And it works the same way with showers and baths. You warm up and then cool down. The other thing is we have to make sure our kids are getting enough physical exercise during the day.
Exactly.
Exercise that increases the heart rate is going to help them sleep. And this is a weird time now because kids aren't doing their sports and doing their activities, but there are lots of YouTube videos that, you can do to, even in the house, do exercises that get your heart rate up. Or again, they can ride a bike, go for a jog. Every patient that I talk to, I say, are you exercising? And if not, I say, you need to exercise because it's going to help us get through this crisis. Sleep, I read something that sleep is off now because people don't have their structure. And again, the last thing is structure will help them maintain the sleep, getting up at the same time, doing their schoolwork, because I know they're still in school, and then doing some fun things afterwards.
Yeah. I would say definitely limiting the amount of screen time, especially since we've shifted to online schooling too. Now it's you're really in front of the screen. So if you're a part of your habits or hobbies before were binge watching Netflix or, playing gaming, like you said, now we're literally in front of the screen for 12 plus hours a day. So if you're not actually outside, please get outside.
Yeah, getting the sunshine too stimulates melatonin release in your brain, which is a natural way to get yourself to sleep. So yeah, getting all the kids, I tell all my patients, go outside, but again, not in crowds. I don't want them exposed to COVID, but this is a very hard time because we have to adjust all our habits. But there's a phrase that goes through my head. We have to be resilient, but also resourceful. And if we can't go to the gym, we come up with other ways to exercise. Or if we can't see our friends, we call them on the phone. We just have to find substitutes to kind of keep ourselves happy right now.
Totally.
So, I wonder if some of that, I just wanted to tag on to the end of that, because the other part of her question was, they're struggling with anxiety. And I hear what you're saying about the routine and how important that is. But, I can say this for myself. As soon as my head hits the pillow and I lay there in the dark, my mind starts going and anxiety creeps in. So do you have any suggestions for that?
Yeah, I mean, I'm going to be pretty specific, but I think doing one of the sleep apps before bed helps. I sometimes do the Calm app. It's about 11 minutes long, and I'll sit in a chair in the dark, and it literally helps you clear your mind. And so what we have to do, because it's normal, we all should be anxious now. I want to normalize that feeling of anxiety, because how can you not be anxious? But we also want to find a way to manage it as best we can. I can't say I'm sleeping great every night. I'm not. I mean, it's just hard to quiet our minds down. But what we should do is if we're having trouble, introduce something new, like try one of these sleep apps, or try the anxiety app. Calm and Headspace are geared for anxiety. And the other things, again, we can step by step do things like increase exercise during the day, and do like really strenuous exercise just to literally exhaust ourselves. Mm-hmm. So we can just keep trying things, but also accept some nights are going to be really tough. But also we were talking before about not watching news at night. Watch a comedy at night. Clear your mind. Clear your mind of the COVID. We've got to clear our minds, because but I wake up every morning thinking about it. It's a strange experience. Oh, and I was going to mention journaling before bed. That's another really good coping skill, and just writing out your feelings. And, so eventually the sleep will get better. But I've heard from a lot of friends that they're having sleep problems. So that is pretty normal right at this moment.
Yeah. I think actually one of the things that I do too is not just the journaling, but specifically focusing on things that you're grateful for. Yeah. So it takes you away from that kind of, what is it that's, getting my wheels spinning about the uncertainty of all things related to life. So if you really make yourself reflect on the day and focus on those positive moments, and it can be something as simple as like, look, I actually sat down and had tea with my parents and we just talked. That can be something that you're grateful for. And then the other thing that I would throw out there too is that I imagine that those like Calm and Headspace have some breathing techniques, but sometimes if you actually just focus on your breath, right? Yeah. So you're intentionally taking a really deep breath in, you're holding it for an extended period of time, and then focusing on that releasing, it shifts everything. So something else to add to what Dr. Morris said.
Yeah. And one thing I didn't mention, but has been shown to help with both anxiety and depression, is yoga. And there are many online apps. I go to a class once a week. I used to attend in person, but I go online now. And so I'm keeping my habit of doing that class. But yoga is really, really good for reducing anxiety. So yeah, I mean, we just have to keep kind of trying different things to address it. Oh, and the last thing though I wanted to mention is, if sleep or anxiety or depression gets really bad, then, I encourage people to see a therapist. And there's an app called I think it's called Talkspace. It's rated highly online. I haven't had, patients actually use it, but I've heard really good things about it. And I heard that, someone had mentioned they're doing some group therapy too online. So if it's getting really bad, there are therapists all over the country are doing online therapy. Generally, you have to see a therapist within your state because of licensing laws, but you could contact a local therapist's office and see if they're doing online therapy. So that's another option if it gets really hard. Yeah.
So I know, Betsy started to touch on it, and just talking about disappointment and grief. And actually, somebody watching, Karen, I'm sorry to hear this, is sharing that she's scared about her daughter going away to school, but also that her stepfather just passed away yesterday.
Oh.
So that's very hard to deal with. And yeah. Unfortunately, there are school-related disappointments, but there are going to be even bigger disappointments for some families.
Yeah.
Yeah, and that's so very hard. And the hard thing also is we can't do our usual funeral rituals, or we can't sometimes be with people when they're dying or sick, and it's a very sad, hard thing. I know a lot of hospitals are trying to do some Zooming or communication with family when someone is near the end of their life. And by the way, the people who are having direct contact with COVID patients, they are my heroes, the nurses and doctors and custodial staff and food workers and the aides. It's unbelievable what they're doing, but you're right. There are going to be losses. And I know a few people who've had COVID and they were very, very sick, and one is not out of the woods. So while we're all trying to kind of keep going and I'm trying to work, we have all these things weighing on us too. And that's hard. I was saying to Betsy before, we need to have self-compassion and understand we're going to feel sad. We may not be at our best, and we're all dealing with a lot. But my heart goes out to that family. It's a very tough thing. Yeah.
Well, and talking about the sadness and the depression, so how can parents tell, our kids are all grieving lots of different things, including the loss of loved ones, but how can parents tell when that scale tips beyond sadness that's, I wouldn't say expected, but that's, an okay level of sadness and grief and despair? And where does that tip into this might be a mental health situation that we need to deal with? How can they identify that, and when would they know to seek help?
Joanna, you go first. Go for it. I'll chime in.
I honestly, as a parent, your child best. And so if you notice some very clear signs of significant changes, so whether that's, experiencing hopelessness, disinterest in everything, lack of motivation, not getting out of their bed, just a complete spiral. And where I'd also say the line's really drawn is, we need to normalize this, because this is what everybody's kind of feeling right now, is just really, really depressive symptoms. But if they are at the point where they're not interested in kind of changing things around, being open to communicating, or kind of just being open and honest with you as a parent of how it is that they're feeling, or if you just don't even have that kind of relationship with your child, I would say seek professional advice, because there's nothing wrong with getting them connected to a therapist or any type of mental health professional far before it becomes a serious situation.
And also, you said it very well, Joanna. And sadness right now is normal, but I would also look at functioning. In other words, have they stopped talking to their friends? Have they stopped trying in school? And I know I read somewhere, I think in New York City, about just a high 80% of students were participating in their classwork, which makes me sad about those kids who were not progressing. So kids who might be kind of saying, I just don't want to do anything right now, I'd be really concerned. And Joanna, you mentioned the hopelessness, but especially if kids are expressing thoughts like, I wish I weren't here, I wish I were dead, that I would want them to get help pretty quickly. Or if they have any kind of specific plan. I was going to mention, you would want to get them immediate help. The question is, with what's going on, could you take them to an emergency room? And some places do have psychiatry emergency rooms, but I was going to mention the Suicide Prevention Lifeline. And I'll just say it's suicidepreventionlifeline.org. The number is 1-800-273-8255. But if you're a parent and you're really concerned and you don't know what to do, call them and they can say, wow, that sounds serious. You need to go to the emergency room, or, oh, well, you should call a therapist the next day. But never ignore even suicidal thoughts that sound vague, because that's a concern that your child might be in distress. The other aspect of feeling depressed might be abusing or misusing alcohol or other drugs as a way to escape. So if your kids start drinking a lot or using drugs, to escape, that could be another indication of depression. But yeah, it is hard to see the line, because again, people are feeling sad, but we still want our kids to kind of function and do what they need to do, again, in school, or to keep their friendships going.
I will say, I'll throw out there too, just like as you were talking about taking, whether it's an adolescent or college age student, depending on, the age of your child, I was just thinking about how, depending on the city, right, some of these hospital beds are really, like, they are not providing even the ability for somebody who's coming in for mental health reasons to intake. Same for detox. It's like those beds are being saved for those that, obviously are symptomatic from COVID. And so if that's the case for where you live geographically, and you are genuinely concerned and need to think about either a hospital stay or just like having medical staff, think about residential treatment programs as an alternative. I mean, oftentimes, especially in my line of work, somebody will go to a hospital first, and then the medical professionals will say, actually, you need residential treatment. Here's some recommendations, or I'll connect you to a professional that can find you. Well, now we might be in a place where we have to bypass that hospital visit and just go straight to residential. But again, as a parent, if you're you understand your child best. So if your gut is hurting, or you've got some alarm bells going off, take that very seriously.
I mean, I'll throw out maybe the little bit of silver lining to some of this situation, and goes to Betsy's name of her podcast, The High School Hamster Wheel, is that some kids who might, in a normal year in high school, and they feel all this pressure because there's all these things that they have to get done. Well, that's kind of, put aside right now. And maybe they, that is, a little bit of relaxation for some of those types of kids who are trying to squeeze it all in.
Mm-hmm. Right.
Yeah, I've actually heard that from a number of parents. Their teens have never been more well rested than they are now, and I can say that's true for mine. And yeah, they're not spending every weekend and every night running to a practice or a tournament. Again, it's incredibly sad, and they're missing it. But to your point, Debbie, I mean, they're getting some rest and some rejuvenation. So as we look forward and we think about the fall, again, uncertainty, but let's say the colleges decide the kids are coming back on campus, and maybe it's August, September, and maybe it's January. It doesn't really matter when, but I've heard from a lot of people, there's a lot of fear about sending their kids to a college campus, knowing that COVID is still circulating and will be for a long time. And not just parents, kids are saying the same thing. I mean, a lot of them had to move out without taking their stuff with them. They had to go back and get it. And, they have a lot of anxiety. And I think they're afraid to go back and go through that again. How do you address that and help them feel comfortable taking that leap to go back?
I mean, I would say really sit on it, think about it, because I mean, I used to say the expression college isn't going anywhere. And I feel like now. There are some colleges that are shuttering because of the financial loss. And so I think, even the interview that you just did recently, like, we are going to see a significant shift in higher education. So I think as a parent, I would actually support your young adult in thinking about what they really want to do, right? You said a second ago, like, this is the first time that my child actually hasn't been against the headwind, right? Or on the hamster wheel. So if all of a sudden they're saying, actually, I want to take a break, I don't want to go to school, great. Support them in doing that. Especially if college ends up being virtual, it changes the collegiate experience. Yeah. Even though colleges are still providing all of those the resources and support services, it's just not the same than an in-person experience. And I'll go back to the expression, college doesn't go anywhere. There are a lot of colleges that will still weather this storm. And for those that are remaining standing, there will be students, right? Class of 2020 and class of 2021, they're going to be enrolling at some point. And so, just being aware of kind of sitting back, deciding what makes the most sense, knowing it's okay not to immediately enroll or re-enroll for this matter. And then the other little piece to this, I would say, is if you are struggling with the anxiety of what if, right? I'm just waiting to end up having this COVID, part 2.0 resurge, and now I'm going to be sent back home, or for a newly enrolled college student, I just got started and now I'm going back home. I think just making sure that they're connected again to the mental health resources proactively so they can anticipate some of these experiences, because it's not a matter of if, but when this kind of resurgence happens. And so we just want to make sure that they're prepared, not completely halted. And when you think about this as a traumatic experience, I would say look up signs and symptoms of PTSD, because I think we're going to see a giant surge too, and in this young population that are going to be experiencing that in the future.
Yeah, and I would also add, especially if a kid has a medical disorder that would put them at risk for getting sicker from COVID, those kids are definitely not going to want to go onto campus until there's a vaccine, or unless they go to an area where there's a low rate. So this gets back to the uncertainty issue. We don't fully understand this virus. We don't know if it's going to slow in the summer. And so I think we're just going to have to kind of take it one day at a time with our uncertainty, because things could change in a day. And but no decision is a bad decision. If someone defers for a year, that's just fine. I have this hope that perhaps they can use some students who might want to take time off from school to do the contact tracing that's being talked about, where you call people who might have been exposed to the virus so they can quarantine. Or even doing online tutoring of younger kids. I have students who lost summer jobs, and I said, look into online tutoring. I'm not an expert in jobs, but I mean, we're going to have to be innovative and figure out a way to keep people employed and busy. But yeah, I read some kids are choosing to defer already. Some people are making that decision.
Yeah, in fact, actually, there's a question here from a parent about, is this a good time to do a gap year? And actually, Betsy and I did a few weeks ago a Facebook Live about gap years. But in some extent, we actually talked a lot about the tactics, you know what I mean? But I wonder if there's more you can add about how a parent and student have a discussion about, is it psychologically the right thing for that student to take a gap year? Because to some extent, once they make that decision, you can't necessarily go back, and it is for a full year.
Mm-hmm. Right. And Joanna you said something to me recently about services available. So go ahead. I know you're already on your way there.
Confident. I have been fortunate enough to be in contact with a lot of gap year programs within the last 3 weeks to ask them specifically around their admission process and protocol to support young people that are experiencing either having had experience pre-existing mental health concerns coming in. So whether that's just anxiety on medication, or if it's somebody that's actually had a psychotic episode, and had some sort of hospitalization. So really trying to just gauge a pulse on what can be, what's provided. And truly, a lot of gap year programs will say that they are not therapeutic. And I'll also challenge everybody that's listening and saying that because of COVID, I think all of us have a baseline of anxiety. And so to say that they can't support any person that comes in with a little bit of anxiety, or maybe, a bout of depression at some point, they can handle that. And so if you are exploring deferring college and you're looking at gap years, know that gap year programs are also strongly pivoting their programs too. So whether they're now saying, well, we might actually do something domestically instead of international options, or maybe we're limiting the international options, maybe we're also focusing to providing volunteer and internship opportunities also virtually, so that students can still remain home, but still participate in a gap year program. Also, the only other thing that I would throw out there too is that, gap year programs, depending on the program, also vary in length. So the term gap year is a little bit deceptive because oftentimes it's actually based on a semester or a couple, it might be like, actually, we just do a 7-week intensive. So there's so much research to be done. If you are really considering a gap year option for school, then I would say look at the Gap Year Association in terms of their programs. Every single website that you'll click on for those programs, they'll have a COVID update on that main site. And the one other thing that I would actually throw out there, which is not necessarily falling within the actual Gap Year Association kind of category, but is a gap year opportunity, is wilderness therapy. I think that a lot of historically wilderness therapy was seen as really behavioral and boot campish, but that's a 30-year generalization and stereotype. And what it exists or how it exists nowadays is not that. We're looking at licensed therapists. We're looking at really intentional programming. We're looking at a lot more young people that are dealing with anxiety, depression, trauma, failure to launch kind of situations. And so to actually send somebody proactively to participate in a small group where you're getting the clinical work, but you're having a lot of those same skills that you might kind of hone in on participating in a gap year program, like leadership or, self-advocacy or confidence. That's stuff that you actually also get in participating in a wilderness therapy program.
Yeah, no, I think those are great ideas if kids choose not to start their year or to take a year off. One thing I would say though, if they, let's say school is online, the clubs will probably be online and there will be an opportunity to meet other students that way. It's going to be very different, but I know of a student who's doing an internship that got changed to a virtual internship, and this student is making friends online with other people in the program. So again, we'll just have to adapt, but we want our students to still be active and involved. And what's interesting about online classes is a lot of students don't like it if the professor hasn't done it before and doesn't know how to use the technology. But a lot of students do like the online classes. So there's such a wide range of views, but I think as we improve technologies and professors get more comfortable, that more schools will be doing this. Or what I see happening in the future is they'll have to be flexible and be able to shift from face-to-face to online pretty quickly. Yeah, so in fact, even in our center, we shifted from face-to-face therapy to telepsychiatry extremely quickly. Luckily, we had some people who had already done a lot of that before who were able to get us set up, but we might have to shift back and forth depending on whether, there are recurrences.
Yeah, that's what my gut says too, is that over the next, from like September going forward, maybe for 6 months or longer, there's going to be this like constant back and forth. Like, things might be semi-normal. They're on campus, then something flares up and we got to kind of, come back and calm things down. So I think people should probably expect some variation of that.
Yeah.
Totally. And actually, one thing that I was just thinking of, and this is just a conversation that I've had with parents before. So, pre-COVID, when that world existed, if I had a college student that did not have a successful collegiate experience and they came home, it was really hard for them to relaunch, like much harder than the parents anticipated. And oftentimes, after doing a little bit of research and kind of information gathering based on the parents, if you make home really comfortable and you don't set clear boundaries or a timeline, I mean, seriously, then you're going to end up with a 26-year-old living at home and wonder how that happened. And I'm not saying that that's a bad thing. I'm just saying, as a parent, just make sure you're really clear with your 18-year-old, 22-year-old, whoever's living at home right now, so that if you as a parent want to be an empty nester at some point and you do want your child to leave, you need to make sure that that's very clear.
Yeah.
Okay, so next up, can we talk about services? So how do you ensure that the services through telehealth, or however you're getting that, your child is getting them now, when they do go back to campus, how do you ensure consistency and no interruption?
Are you saying, well, if the schools have the technology, they can flip back and forth between face-to-face and televisits. But what's happening is all of a sudden the schools had to shift, and some schools were able to shift more easily than others. Therapy services are separate and sometimes administratively separate from psychiatry services. So one service might go easily into the telemental health, the other might not. So so there can be a gap depending on the school. So I think what parents need to do is know what the services are going to be on campus, and usually the websites are going to tell you what's happening with services. They'll say if it's face-to-face meetings, telehealth, but even going pre-COVID, parents need to know a lot about the services, because some schools have short-term therapy programs, but long-term psychiatry. So, like you might know your kid could get all their psychiatry services there for 4 years, but they might have to go off campus if they want to do long-term therapy. So whether we have this pandemic or not, it can really help for parents to go on the website and find out what the services are. And then, like you've talked about this, Joanna, but pre-arrange, even before they get to campus, figure out where is the best place to get services, because it might be they can get more in some places I might get more comprehensive services off campus. And only about 50 to 60% of colleges have psychiatric providers on campus, which could be like a psychiatrist or nurse practitioner. So there's a lot of legwork that should go on in advance. But in terms of interruption of service, it's really incumbent on the system to make sure there's consistency and that messaging is sent out to the students. I know in our clinic, we sent out an email immediately that we're going to transition to telepsychiatry. We're going to keep the same appointments. We're not canceling. But so we did communication with the students to let them know we were still continuing. So, but yeah, it varies that's the other uncertainty. It can vary from school to school, but it can happen. I've seen a lot of schools adapt very quickly to telemental health. So.
Yeah, and I'll throw out there too that if it's somebody like, if the example being a high school senior who is anticipating going to college in the fall, and they are seeing a therapist right now, whether that was pre-COVID and they were meeting in person, or all of a sudden now it's transitioned to telemental health and or they're just meeting with this therapist for the first time. If they actually like that therapist and want to continue the therapy, it's on the therapist to have the licensing for wherever it is that the student's going. So right. That's where there might be that cut off and needing to pass the torch or find another professional in that state. Yeah. But otherwise, I've worked with clients before in the past who have been really happy with the school that they're going to, who also had a very robust counseling and health, overall health department, but that student really had great rapport with their therapist from home, and they wanted to continue to do the work. I don't think there's anything wrong with that. I do think that as a parent, going back to the conversation about having that HIPAA release or FERPA release, if your child does not have those signed, and now all of a sudden you're kind of in the dark, there is the possibility, or there's room for your young adult to be dishonest with their therapist about how college is really going for them. And if we don't have those, those signs formed, I just said that wrong. That's funny.
Mhm.
Form signed. Like, right? Then that's where there's an opportunity for kind of that misconnection, and ultimately somebody who walks away saying like college was great and they completely melt down and have like a 0.0 GPA.
You know, Marcia, you mentioned kind of checking out the services at a college. I mean, and might be parents and families watching here with, students in 10th grade, 11th grade that are kind of starting the search process. And it, even I want to say in normal times, I think it's a good idea to understand what those services are at any of the schools that your student is thinking about, because, as we've all been talking, this is a big transition. And even though maybe your child didn't have any issues that you were aware of in high school, they can develop in college. So you still want to know what those services are that the school provides or doesn't provide, so that you know what you're getting involved in if your student needs to rely on them.
And it's good to talk with your kid about the services, even if they don't have any current issues, and say, sometimes college students get depressed or anxious, and I want you to seek help and go to the counseling center. And what can happen at the counseling center is, even if they do short-term services, often they have case managers who will connect the kids to services off campus and look at their insurance. So that's so even if they can't get all their services on campus, usually there's someone on campus who can help them find the care off campus. So it's really important to connect services. And Joanna, you mentioned that there can be that transition from high school to college. And I just read somewhere that's where a lot of kids can drop off and not get the services because they're busy signing up for classes, and they're not thinking about getting into the counseling center. And when they finally do, there's a month wait list. So it's like, even I would say, if someone, wants to figure out their services, call the first day of school or the second day of school and get that initial appointment, so you can figure out, am I getting my care on campus, off campus? There are a few schools that let you make appointments even before you start school, but so there are different systems, but the students will find care. It's just but what the parent should play a role in making sure that it doesn't fall through the cracks. Like, let's say they don't like the person they see at the counseling center, they may not go back, and you may not realize it. So it's important for the parent to say, how did that appointment go? Did you like that person? How's it, we want to make sure they continue with some service if they are having any symptoms of depression or anxiety. Oh, so what? Yeah, go ahead.
No. So this is similar. Avery is asking, how do I make sure that my daughter gets the same supports that she has at home in college? And, it's kind of similar to what you're talking about, that they need to research that, as part of the college that they're selecting.
I would throw out there too, just to kind of piggyback on what Dr. Morris talked about, for only 60% of colleges having psychiatric services on campus. If your child is going to a college that falls within that 40%, to get an appointment with a psychiatrist, I mean, you could be looking at anywhere from 4 to 8 weeks out, depending on the location where you're going to school. So it's really important to be proactive and how all of that set up prior to, I mean, this is really like, we're talking about high school graduation. As we're thinking about that graduation timeline, I need to already be doing research and finding out who is actually accepting new clients. Will my insurance cover it? If it doesn't cover it, who can I afford? I mean, these are all things that not just the young adult, but truly the family needs to be thinking about, because this is completely an out-of-pocket expense.
And even in addition to the mental health resources, there are other great resources on campus that can kind of step in for what the kinds of things parents might have done. Like, there's some schools have what's called success coaches or care teams. And for kids who might not be sure of their majors or what they want to do, they can act as a kind of a support system for the student as they're figuring things out. And also, if they have diagnosed ADHD or even anxiety or depression, I strongly encourage the students to register at their campus disability resource center, because let's say they have test anxiety, they can take the test in a quiet setting, or if they have ADHD, they might have time and a half for their exams. But it's really, if they think their mental health issues might interfere with schoolwork, they should register, they can get accommodation. So the schools have a lot of resources. The issue is getting the students connected. And at some schools, they're all in one building. At other schools, they're spread out all over the place. So for a freshman, it can be very overwhelming. So I would say, and I know I'm talking about like physically going there, but if there is an opportunity to go there and go to the different buildings, usually they have tours for that, but just learn where the different buildings are where students can get help. You know, it's important. I forgot to mention one resource that I did want to mention it's actually for college students who might be struggling now. I know someone, her name is Ritzy Edinger, and she just literally started a podcast called Imperfectly Perfect. And it's on iTunes, but it's interesting because she finally had time to work on it because she had to work from home and couldn't go anywhere. So that was the irony for her. She even talked about that in her first podcast. But her most recent one is coping with loneliness and social distancing. And she's a very inspirational speaker. So like if your college student is struggling, you can say, you should listen to this podcast, Imperfectly Perfect. And Betsy, I gave you the link, so hopefully you can put that up, because I was just listening to it before this, our talk, and it's very good. And Debbie, you were saying, how do we help parents? And you know, all of what she says about the loneliness and social distancing applies to us and how we're feeling. We're all going through this common tough experience. So I think if you listen, you know, parents can listen to it too and feel good. So listen to different podcasts. There's so many uplifting, and I'm so glad we're doing this now, but there are many podcasts. And this one that is cool because it's directed for college students. So I think, yeah, so I'm excited about it.
Well, any other advice or resources that Joanna, that you or Marcia, you wanted to share?
I mean, I'll do my shameless plug for my podcast. It's called Success is Subjective, and specifically the people that I've interviewed have been college students who took a break. And so really the audience is college students themselves and or parents, just to hear, you know, somebody's journey based on, you know, what education was to them prior to college. And this kind of speaks to the hamster wheel, because that's kind of the majority of the people that I've interviewed. They were just on that train and they went with it. And then when they got to college, you know, the wheels kind of fell off for a number of reasons, and everybody's journey is different, but they're all in a very different place now. So, you know, again, if you like podcasts, it's a great, you know, it's certainly my imperfect practice is doing these interviews, but I enjoy asking people their stories and ultimately getting back to, you know, do you see yourself as successful now? Because the definition of success can be so subjective. The only other thing that I would throw out there, I mean, obviously I need to just reiterate, I think wilderness therapy can be really appropriate and people aren't really thinking about it right now. And so if you're interested in that, I would say hire a consultant if you can do that to get, you know, the guidance to find the right program. If not, definitely check out the Outdoor Behavioral Health Care Council. That's where a lot of those member organizations exist. And there's also a new website called Thriving Campus, which is specifically partnering with a lot of colleges to provide, you know, therapy basically for students in the community. So if the college doesn't have the number of, you know, mental health staff, that the capacity is kind of off or the numbers are off, Thriving Campus is a growing website to provide that as a resource to young people on campus now.
Good stuff.
And I'm going to mention my book one more time, Campus Cure, if I can get it in the picture.
Yes.
But yeah, the book talks about different issues like depression, anxiety, even psychosis, where people lose touch with reality. And I try to explain to parents how you recognize this and how you can help students with these problems, because problems do increase biologically in the college years. But I have a chapter on loneliness, but I talk about making sure students have face-to-face contact, and I'm going to have to change that chapter in the future. Have some kind of, just contact in it whatever way they can, because I've come to appreciate the social media and how Zoom and FaceTime and all these things that are allowing us to connect. So I'll have to revise that chapter. I have a blog on Psychology Today for parents called College Wellness. So I hope that's helpful. And it's great talking with all of you today.
Yeah, I mean, honestly, I have found we do a weekly, anybody who's in the audience and who's in our Facebook group, we do what we call a coffee clatch of parents, and it's just, and I get off, and sometimes it's been 4 weeks that we've been doing it, and just all the, we're parents and we're getting together talking about the issues related to college, but it's almost like a little bit of just college therapy, just kind of like, being able to hear somebody else have the same issue that you do, and you're just kind of, able to talk a little bit. And even though, I'm not physically with anybody, but just, it helps. It does help.
It definitely helps.
We're all in this, right?
We sure are.
Sure.
Yeah.
Well, thank you so much. Thank you, Marcia and Joanna. This was really helpful. And hopefully we gave some ideas and resources to people out there. And maybe we can have you back on a different topic, even if COVID's still going on, post-COVID, but definitely have you back and to talk about more of these things.
Great. Thank you.
Okay. Thank you, everybody.
Bye.
Bye.